Hey, what's up, guys? This is Dr. Enoch Kotei, the primary care physician you can trust, breaking down the topics you care about in a way that you can understand. It's a beautiful day out here today. I'm just out here in the sunlight trying to get my vitamin D up. You might have been hearing all sorts of things about vitamin D in terms of what it can do for the body, trying to figure out what's real and what's not, right? Well, if so, to stay tuned because we're going to talk about what we really know in 2019 about vitamin D in terms of the benefits and the consequences of having low vitamin D. So vitamin D is a vitamin that we make through our skin that enables us to take the calcium that we get from our diet and actually absorb it so it can travel to our bones and strengthen them. Before it can do this job, vitamin D has to get converted into an active form after traveling through our liver and our kidneys. Now, most people with vitamin D deficiency don't have any symptoms at all. But in cases where you have a severe deficiency for a very long period of time, then it can potentially lead to issues with walking, make your bones very brittle, and increase your risk of falls and fractures. Vitamin D deficiency is very common. As a matter of fact, the National Health and Nutrition Examination Survey estimates that about 40% of adults are deficient in vitamin D. Now, for me personally, I work in a clinic in which the patient population is predominantly Black, so it's actually very rare for me to see somebody who's not deficient in vitamin D. This might have something to do with the fact that for Blacks, the pigmentation on our skin actually blocks the ultraviolet radiation from causing production of vitamin D in our skin. Other risk factors for vitamin D deficiency include those that are obese, people that have little exposure to sunlight due to being institutionalized or hospitalized for extended periods of time, folks that are on medications that break down vitamin D really fast, and also patients that have conditions with their gut that don't enable them to absorb vitamin D very well. All right, now this is the part where it gets tricky because there's a lot of buzz going on right now about all the different things that vitamin D can do for the body in addition to strengthening the bones, such as improving diabetes, lowering your risk for heart disease, strengthening your immune system, fighting cancer. So we're going to talk about all these different things one by one. The reason why we started to look at vitamin D in regards to diabetes and heart disease in the first place is because we know for a fact that people with these conditions in general have a lower level of vitamin D than people that do not have these conditions. So we thought that maybe putting them on vitamin D supplements can help improve the outcomes for heart disease and diabetes. However, it has not quite worked out that way. When it did large studies that were randomized and tried to see whether or not supplementation helped improve these conditions, it showed that it actually did not. With cancer, it's sort of a similar story. Number one, certain cancers have been associated with low vitamin D levels. And number two, when they did studies in the laboratory, they showed that vitamin D had the ability to slow down the growth of cells. So for these reasons, they thought that maybe supplementation with vitamin D could actually help prevent cancers. However, when they did studies, they have not been able to show that vitamin D supplements can lower the risk of any type of cancer. Because vitamin D has the ability to regulate the function of certain immune system cells, it was thought that maybe it could play a role in diseases such as asthma and other certain types of autoimmune diseases where the immune system attacks your body in different places. However, when they did studies on this, they have not been able to show that supplements can actually improve the outcomes of these conditions either.
So, I mean, what does it do? What does it do? I mean, what are you saying? What does it do? Huh? Huh?
All right, guys. Now hear me out. Vitamin D does have some benefits. Because it helps incorporate calcium into our bones, it can improve bone density and the outcomes in regards to diseases like osteoporosis or brittle bone disease. A large study performed last year showed that vitamin D, when taken by itself, doesn't necessarily reduce the risk of bone fractures, but when taken along with calcium, it can reduce that risk. There's also a possibility that vitamin D can reduce the risk of falls. Studies performed a few years ago showed that vitamin D, when taken by itself as a supplement, reduced fall risk. However, more recent studies show that this risk reduction might not be as great as we initially thought. Now, one of the most interesting things about vitamin D is that in multiple studies, it has actually been shown to reduce mortality. In other words, it can actually help you just live longer in general. And who doesn't want that, right? Now, one thing that's clear with all this is that we definitely need more studies to be done in the future so we can really find out more about what vitamin D truly can do for you. I should also mention that personally, when I identify patients with vitamin D deficiencies, I usually tend to start almost everybody on supplements. And the reason why is because even though some of these studies have shown modest benefits in terms of supplementation, like I mentioned before, I work in a clinic where the patients are predominantly Black. And I believe that Blacks are actually underrepresented in a lot of these studies. So even though they might not be as beneficial to other groups, they might be more beneficial to our group. Also, I think that a lot of these conditions that we discussed, they're associated with low vitamin D levels, but it might be possible that the reason why we can't reverse things with supplementation is because by then it might be a little bit too late. But if somebody has really low levels, if you put them on some of these supplements, we might be able to prevent them from developing these conditions in the first place. And that's something that hasn't really been looked at through many studies. I've also noticed that when I place patients on vitamin D supplements, they tend to just feel better in general overall in terms of their health. I can't quite put my finger on it. It might be a placebo effect, who knows, but it is a trend that I've been able to observe over the past few years. It definitely is possible to overdo it with vitamin D. And most of the time when something like this happens, it's because somebody is prescribed a 50,000 unit of vitamin D, which is only supposed to be taken once a week, and they make a mistake of taking it once a day instead. So when you do things like that, it definitely can cause an excess of vitamin D and vitamin D intoxication. And the symptoms of this include things like confusion, anorexia, vomiting, muscle weakness, and the urge to have to urinate and drink a lot of water. If something like that does happen, then just make sure that you seek medical attention right away. Now, in terms of getting your vitamin D levels up, we take in some vitamin D through our diet. Vitamin D can be found in dairy and also fatty fish as well. However, other than that, there's not many other ways to take in vitamin D through the diet naturally. And I don't want to tell everybody to just go ahead and just consume a bunch of dairy, because not everybody is tolerant to dairy, and it can actually have other negative effects on your health and your diet. So a lot of times what I just tell people to do is that if they're deficient in vitamin D, I recommend that they take a supplement. I mentioned the 50,000 unit vitamin D that you take once a week. That's usually how people start off treating vitamin D deficiency, because that's a way to build up the stores in your system. And after that, once you take that for about 6 to 8 weeks, then you can transition to a lower dose supplement that you can take over the counter or that you can still have prescribed. Other ways to increase your vitamin D, sunlight is the biggest thing. Just a few minutes of sunlight a day, a few additional minutes over what you would normally do, can actually go a long way in regards to increasing your vitamin D levels. Now, that doesn't mean just sitting out in the sun all day and getting ultraviolet radiation directly beamed onto your body for about 10 hours straight, because obviously that will lead to other negative things too, such as skin cancer and sunburn. The only way for you to know whether or not you need to be on a vitamin D supplement is by going to your primary care physician or your primary care provider and having them check the levels of vitamin D in your blood to see whether or not you're deficient. And if it turns out that you are, then they'll make a decision based on your medical history and other medications in terms of whether or not you should be on a supplement. All right, guys, so there you have it. Vitamin D, the benefits and the consequences of deficiency. If you learned something, please give me a like and subscribe to Trust PCP. If you have any comments or questions, please post them down below, and I promise that I'll get back to you on those. Thank you for watching, and peace out.